Trypophobia is a condition where a person experiences a strong and irrational fear or disgust of clusters of small holes or bumps, such as those found on the surface of certain fruits or seeds, or in certain patterns. It may also be a feature of obsessive-compulsive disorder, OCD. Trypophobia triggers may include bread and bagels with seeds, cheese with holes, fruits with small seeds like strawberries, raspberries, papaya and kiwi, honeycombs, sunflowers and lotus seed pods, insects and bees, skin on snakes, lizards, frogs and other reptiles, soles of shoes, sponges. This fear can range from mild discomfort to intense anxiety and physical symptoms such as sweating, shaking, or a rapid heartbeat. The exact cause of trypophobia is not known, but some theories suggest it may be related to an evolved aversion to potentially poisonous or contaminated substances, or an instinctual response to patterns that are commonly associated with dangerous animals such as snakes or spiders. The symptoms of trypophobia can vary from person to person, but some common ones include 1. Anxiety. People with trypophobia often experience a strong and irrational fear or anxiety when exposed to images or objects with small holes or clusters of bumps. 2. Disgust. Some individuals with trypophobia may also experience feelings of disgust or revulsion towards these patterns. 3. Physical symptoms. The fear response associated with trypophobia can also result in physical symptoms such as sweating, shaking, increased heart rate, and even nausea. 4. Avoidance. People with trypophobia may avoid looking at or being near objects or images that trigger their phobia. 5. Distress. Trypophobia can cause significant distress and affect a person's quality of life by limiting their ability to engage in certain activities or by causing intense anxiety or fear in certain situations. Details of the diagnosis trypophobia test. Displays a variety of images for 1 to 8 seconds each. Some of the images have patterns or clusters of holes, while some do not. Asks you to estimate how long you saw each image. Compares your estimates for viewing trypophobic images and neutral images, those without holes, and gives you a ratio at the end of the test. A ratio higher than 2 may indicate trypophobia. The following are some treatments that may be helpful for some individuals with trypophobia. 1. Cognitive behavioral therapy, CBT. This is a form of psychotherapy that aims to help individuals recognize and change negative patterns of thinking and behavior. CBT can be effective in treating trypophobia by helping individuals identify and challenge their irrational fears. 2. Exposure therapy. This form of therapy involves gradually exposing the person to images or objects that trigger their phobia in a controlled and safe environment. The goal of exposure therapy is to help individuals overcome their fear through repeated, controlled exposure. 3. Relaxation techniques. Relaxation techniques, such as deep breathing and progressive muscle relaxation, can help reduce anxiety and physical symptoms during exposure therapy. 4. Medication. In some cases, medication, such as anti-anxiety medication or beta blockers, may be prescribed to manage the physical symptoms of trypophobia.